Well, hello folks. Today is my day prior to surgery. So tomorrow I am getting surgery done. I have nasal polyps. If you've watched my channels, I've said things about it in the past. It's something I lived with for a very long time, and it's time to fix it. Finally, I've been putting the surgery off, putting it off, and medicating it, and it's just I'm done medicating it, at least as much as I have been. So, nasal surgery, and so this is going to be a septoplasty, trombinoplasty or something, endoscopic sinus surgery, and nasal polypectomy. Lots of fun. I get to go under, and first thing tomorrow morning. So this might look a little different because they're also going to fix the deviated septum that I've had since I broke my nose back in college, so a long time ago. I feel confident with my doctor. Really great guy, and it seems like he knows exactly what he's doing, so I'm feeling good about it. I really am. But I thought I'd do some videos. Today is the night before surgery, so in less than 12 hours they will be working on this bad boy, and I'm hoping to do another video tomorrow after surgery when my nose is completely packed, which I'm going to be honest with you, isn't going to be that much worse, I think, than what my nose normally is, because it's always clogged, especially if I'm not on a whole bunch of medication. So calm before the storm. This is my story, told in spurts, I guess. Tonight, the night prior to surgery, and this is what I look like, and this is what I sound like. This nostril's pretty much clogged, but yeah, so night prior, we'll see you tomorrow. And I'm ready. Let's do this thing. So I just got home not too long ago, and everything went successfully. I'm just super tired, and yeah, there's some pain up here, but more uncomfortable than anything else, and a really dry throat from them intubating me or whatever. So I'm trying to fix the sore throat and hopefully get some rest. So, yay. Just quick update video. It's 8:50 at night, 9 o'clock at night, after day one of the surgery, which was just over 12 hours ago now. And as you can see, I have a lot of drainage. I've been changing this constantly all day. And it's not painful, it's sore, like the whole nose is sore, but it's just uncomfortable because, you know, I can breathe a little bit through it, but it's sore, and it's just constant. The soreness doesn't go away, and you can't blow your nose even though you want to. And if you sneeze, it hurts so bad. I only sneezed once today, and it seemed like it had stopped bleeding, everything was good, and then I sneezed, and that's when this blood came. So I'm very tired. Mostly, this morning coming out of the surgery that was the most miserable part, because my throat hurt so bad from the air tube. It's now finally getting to the point where it's not too sore anymore. But that was the most uncomfortable part, was the throat, actually. And yeah, I was tired from after the surgery, and just being in the hospital bed waiting to leave. That was probably the most miserable part of the day. Everything else has been slightly getting better, mainly because my throat's been getting better. And but it's very hard to eat or drink with this thing going on, so I'm gonna hopefully get a good night's sleep, because it's been just kind of up and down all day. No sleeping really a whole lot because it's just uncomfortable, and I'm hoping that tonight, with taking the medication that's making me drowsy again, I sleep better. So that's what I'm going for. So that's my update. Well, at least today I feel good enough to drive. Yeah, I'm stuffy because my nose is full of stuff. My nose is bleeding, obviously. But I feel good. So that's the good thing. And I'm not on medication right now. The Tylenol would have ran out at like 9 o'clock this morning, and it's 2:30. So I don't have any pain. It's just nose full of stuff and dripping blood. So that's good. And downstairs is just what it is. It's fine. So far so good. Okay, so we are at the end of day 2. So it's been 36 hours since the surgery, and I don't have any pain, both from this surgery and that surgery. Just discomfort, and because it's all packed, I've had a few sneeze sessions, and which caused more blood. So it's just been figuring things out. It is what it is. It's just uncomfortable. That's all it is. It's not painful. It's just uncomfortable. And keeping up with my medication. I didn't take any pain medication all day today until tonight. I took the hydrocodone tonight so that I get a little more drowsy for hopefully help me with sleep a little bit, just because of the discomfort, but not so much because of the pain. So it's what it is. I'm looking forward to relaxing. Hopefully tomorrow I feel better yet. Because today I didn't feel bad. I just felt, So I'm hoping tomorrow better yet. Every step of the leg up is always good. And I'm looking forward for a shower tomorrow, so I feel clean, I guess. So yeah. Okay, end of second day post-surgery. So surgery's Wednesday morning, it's Friday night. So feel great for the most part. It's not really sore so much as just uncomfortable with how much stuffiness. However, you can tell that when they were pushing, putting the instruments up, pushing pressure on my front teeth, which I noticed a couple days ago even a little bit, but now that the sore throat's gone and everything, that's becoming more prevalent. So the most annoying thing now, other than breathing, is just you can tell that pressure was put on the front of my teeth. It's just, I mean, obviously they have to rest somewhere, but downstairs good. This is just lots of clot central. This morning when I woke up, I pulled a huge clot out. So what I thought was may have been shifting down. It didn't. It was just a huge clot at the end. So everything's good. I'm not getting near as much drainage. I put this on just for tonight. So I actually was without any gauze on my face for a couple hours today. Felt great, but I figured for nighttime at least I'll throw some gauze on so that way I don't get drainage or it getting on the sheets or whatever. So yeah, it's going good. Feeling better. I gotta take my medication. Good thing I thought of that. But yeah, that's where we're sitting. I know it's coming. Blah. So quick update, not a whole lot of changes today, but other than my nose really stopped dripping. So most of the day I actually had my nose clear with no pad on. I just put this on for sleeping, just because I'm not going to be up if it does leak, so I don't want it all over my comforter and stuff. So yeah, pain, no pain, other than the tingling from in the front of the teeth. And I think that's just actually from pressure from the nose, because last night I woke up and my teeth weren't that bad at all, and of course you're laying back a little bit, and then all day today sitting up, even without this on. I don't know. Guess we'll find out, but no medication tonight other than just the standard stuff. I'm not going to take pain medication. I'm just going to go with it. So hopefully I sleep better. I don't know if you can see that or not. You can see the little moves up in there. Still washed it out a little bit. I don't know. Okay, so full update. Sunday night. It's been now, what, 5 days, right? 4.5, whatever, since the surgery. I feel good. Obviously, nose almost completely blocked. Very, very limited air at all, unless I really push for it, which I shouldn't. I actually just washed my nose. I found that to be very lovely. And just the end of the nose, just running it under warm water under the faucet, gets all the caked blood off, and I don't touch it. And that's when I noticed that there are some stitches right here towards the tip of the nose, just back inside, which is probably where the tingling's coming from in my upper lip movement, because that's going to have to heal, obviously. I'm assuming that's where it is. No real pain. And obviously, I've been going as much as I can without having the gauze on the end, like I did yesterday for the most part until the end of the day. So tonight, I'm probably going to put gauze on my nose again just for dripping at night, and I don't want to deal with getting my pillow full of blood. But again, I'm going to go to bed without medication other than just the antibiotic from the surgery. So I'm feeling good. I go back to work tomorrow. Light work, but out of my house at least. And I'm just going to have to watch the dripping, because even today I was shopping with my kids for Secret Santa gifts and all stuff, and every so often just get the blood, and I'd have to take a tissue, keep a tissue with me, and just kind of dab it every so often. But it's better than having gauze on my nose all the time. So yeah, that's where I'm sitting, feeling good. Tomorrow, the stuff that's up in here, you can see the stuff up in there. After I wash it out, you can actually see up in there. So that comes out tomorrow. I don't know if I'm really looking forward to that or not looking forward to that. I'm looking forward to that because I should get air movement again, which I can't tell you how much I'm going to love. Being a person that had polyps for so many years, I know what that's like when you all of a sudden can breathe again. It's like life. But I'm not looking forward to the process of pulling all that caked in stuff out. We'll see. The doctor did an amazing job, and I trust him absolutely after the job that he did. Because here I am with all that surgery and everything. I look like me. I mean, I don't have bruising anywhere or anything, so, yeah. Dr. King, you're awesome. Hopefully tomorrow goes good. So, have a good night. We'll see you tomorrow. Okay, I just want to do a real quick video. I'm in the car. I'm going to head into my appointment to get this stuff out of my nose. The only pain I've had so far today is just actually right at the tip of the nose. It's almost like nose hairs are being pulled or something's being, it might be just the bond after they stitched it. I don't know. So once I washed it out, it helped a lot. It's not hurting so much right now, but about noon today, it was not so good. So, and that's when I washed my nose again, and it felt great to do that. But that said, pain for everything else, it's just full and stuffed, and I am able to actually breathe still out of this left nostril. Just a little bit. But the right one's still fully clogged. Obviously, blood clots are clotting that. So, got my mask. Gently put it on. I'm going to go inside and see what they have to do. Oh boy, here we go. A little bit scared. They don't look like they're going to be pleasant. And I get to play with that. I have other ones like that, but not that one. Yay. I'm assuming that I'm bleeding down the nose, but I got everything out. I have air movement for the first time in 15 years, as much as possible. And it didn't hurt him pulling all the stuff out. It was weird. It felt like a COVID test, kind of, when the brain scan kind of one, where he was pulling stuff from way back in, but it did not hurt at all. I'm so thankful that it didn't hurt. Nose has been all sucked out, irrigated, and Vaseline closed.
which I'll be doing for the next couple weeks, but I feel way better. Yeah, now I can move my lip again. That's good.
Okay, so this is going to be probably my final video because everything is now where it will be at least for the next 2 weeks. Where I'm at is, if you can see, I have to rinse my nose twice a day and pack it with Vaseline, essentially to block any air transfer as much as I can to keep moisture in there, and to keep it healing, right? I don't want to dry it out, and especially now that it's getting winter time, air is even drier than it is before, and even at night with the furnace running, even though I have a humidifier, I don't want that drying out. So I might actually get another smaller humidifier just for my bedroom, just to keep it more moist in there, just for this purpose. But that said, I feel so much better already. Even though I don't really have a whole lot to use my nose and I'm trying to keep the Vaseline packed, I gotta go get some more Vaseline. The stitching that was in my nose that I saw before, that wasn't to fix something with my nose. That actually was the line that was keeping, essentially, I think it's a surgical sponge, tied onto that to keep them from sliding back down the backside of my nasal cavity and then getting wedged down in the back, make it way worse. That's what that was for. So he snipped it, and first he pulled out these 2 plastic pieces that were actually there to support my septum, to straighten that back out. So he pulled those 2 out, one out of each nostril, which felt interesting, didn't hurt. Then he pulled out those sponges one at a time, which were caked in gross, bloody, clotted loveliness. And again, the best way I can describe this is if you ever got one of the brain scan COVID tests like that, but bigger, no pain, just this what the heck sensation kind of thing. No pain at all. I was so happy it wasn't painful. However, then he took an actual sucking tube, went all the way back in there, sucked out as much of the clotty stuff as possible, and then moistened my nose and plugged it with some Vaseline, and I've been trying to keep it plugged as best I can, and I gotta get some more. But either way, I am very, very happy already. But I will say this, before he plugged it up, I was able to breathe. And holy cow, the amount of air movement I get in my nose now is, I don't remember it. So I'm happy to keep the Vaseline kind of plugged, at least a portion of it, or most of it, because I think with the cold air as well, it's not gonna feel good right away. And I've got a lot of healing to do back there, so I may do a video down the road about this, but all the nasal stuff that I had done, and I can't wait. He showed me when I was at the doctor's office, he showed me when I was actually coming out of surgery, showed me pictures of before and after. I don't remember what they look like because I was still loopy as crazy, but I talked to him about it today, and they were supposed to give it to me in my paperwork from the surgical office, from the clinic. They didn't, so he's going to get it for me on Wednesday when he's in there. So, yeah. If you're really interested in seeing those pictures, that'll be on a separate video, I guess. But that said, I feel so much better, and everything's good. So, it's been a fun one. Thanks for watching. I feel way better. And by the way, my lip is now, I can actually smile again. As soon as you get that out, everything will be back to good. So, yay. Thanks for watching. See you soon.